All right, Colleen, thanks for joining us this afternoon at the Becker's conference. I appreciate actually that Paymerang is going to join us here for this conversation because you folks are a very innovative organization. So this is right in line with what we're trying to accomplish with the RCM Innovators series. And one of the things I'm actually really excited to hear from you guys about, so a lot of health systems kind of, well, I would say collectively American healthcare in general is not necessarily recognized for being massively innovative, and in particular in the back office not being recognized for being massively innovative. Some people have commented that American healthcare might be 10 years behind. Some have said more.
Right.
So I think one of the most important things to do when you really see that as an industry you may be lagging is to become equipped with how do I determine in my own organization if my organization is an innovative one, right? So do you have suggestions for like the hallmarks, signs, indicators, measures, whatever, qualitative, quantitative, whatever they might be, so that a health system can say whether or not we're high on the maturity curve of innovation or low on the maturity curve? What are some of the things you think about that?
That's a great question. So some of the things that I would ask, just especially in the back office, would be, are you automating processes?
Okay.
At this conference, there's lots of technology providers and solutions. I think one of the key indicators is how are you taking advantage of automation to help your business office and your team? A lot of healthcare providers are being asked to do more with less. We know staffing is a huge challenge, so technology can come in and help automate some of those processes to make it so they can better deliver on their missions.
Sure. So if it's like now a healthcare organization, maybe they gauge and they say, well, maybe we're not doing so great on the measures of our innovation, but they're eager to evolve, right? Mm-hmm. I mean, you guys, again, clearly a very innovative organization. Do you have suggestions, tips, best practices for a health system leader, right, to seek improving that area of their business? What would you say? How do you get started in moving the needle on how innovative an organization is?
Yeah, I think you can start by seeing what's out there. There's lots of solutions. A lot of the feedback that we get from prospective hospitals is that they're too busy. They have a mentality that they're too busy. We know they're being asked to do a lot with less. But keeping an open mind and realizing that you're not too busy to automate and making it a priority to automate some of these processes will actually put time back in your day and in the team's day. So that would be my
So you guys, I would say, invested in innovation, right? You have a strength of it. What are some of the things that you did, ways that you spent money, ways that you staffed up, systems that you built, other things like that? How did you build that muscle of innovation?
Yeah. It comes down to our people.
It comes down to your people.
We're very proud of our people and the technology that we've built with our people. We believe in having the right people on the bus.
Sure,
and having the right people on the bus enables us to better support our clients.
Totally dig that.
And we like to share with our clients that our team becomes an extension of their team, right? So these industry professionals, these enrollment payment specialists become an extension of the back office team, of the finance team. And we know that hospitals today are they're trying to overcome staffing challenges. So that's
I want to ask you about that piece of your team becoming an extension of their team, because I think that's actually a very important thing to be happening. But before that, as you mentioned, it's really about the people. It's a great point. If you're out there looking for staffing up, filling the bus with people who have that strength of innovation, do you have suggestions for health system leaders on what qualities to look for, what kinds of questions to ask? How do you succeed in filling the bus with innovative people? Do you have thoughts on that?
Yeah, I think it's finding people who have an open mind, who maybe they've implemented a solution at a prior role that they could then bring to your organization. I think that's a great place to start, is asking, hey, what technology, what solutions have you worked with and have helped your organization, and can you bring to our team? And we like to help educate our clients and their team, their FTE employees, to feel empowered to do more mission-critical things. We offload the manual processes so they can focus on higher level priorities. So I think asking those questions about, what drives you, what gets you up in the morning, those are some of the questions that our team asks. And as we're adding people to our team and we work with clients, that's something that's important to us.
Dig that. And as you're doing that, as you're in that process of evaluating these individuals, considering them to be members of the bus, are there specific characteristics that stand out for you that you're looking for that say that person's going to be an innovator, that person's going to help move us forward, move our clients forward? What are the characteristics that you're looking for?
I think just someone who has an open mind, obviously. There's so many new solutions, being open to seeing what's out there. Hard work. I mean, solution, it's not going to always work right exactly the way it should be the first time. Being able to problem solve, troubleshoot, things like that.
Yeah, innovation is a messy process. Yeah. So now I want to get back to what you were saying a minute ago about this partnership, right? When you're working really in a hand-in-hand way with your clients. Can you tell me more about what that really looks like in the vein of innovation? How do you create an effective partnership with your clients to move yourselves forward, themselves forward in this cooperative way? Tell me about that.
Right. So our goal is to help our clients become more efficient.
Sure.
We want to take those manual invoice and payment processes off of their plate so they can focus on their mission and providing better patient care.
Totally.
So being able to do that, we have a team. We have an implementation team that walks them through the quick process that takes 10 hours or less of their time. We have ongoing support, so they know they can call our team. They're going to dial a number and talk to a real person. There's not chat bots. There's not automation in that regard. It's they have that hand-in-hand interaction and partnership with our team that's ongoing.
Yeah, I dig that. And as they're experiencing challenges and opportunities within their own business line, I'm sure you guys are in communication with them. Can you kind of walk me through what it looks like to create a strong partnership towards creating new solutions, right? So how do you work with clients in that way? What kind of communication processes do you have? What kind of innovative workshops? I mean, whatever it is that you do, can you kind of fill in that picture for me?
Yeah, definitely. One thing that we're doing for our clients this year is we're doing a user conference.
Oh, great.
So we're hosting an event to help show them the latest and greatest. We're having our team provide updates, show them tips and tricks and ways that they can get the most out of the program.
Yeah.
We also offer ongoing thought leadership. So
cool.
We work with over 100 industry associations across the board nationwide, some big national partners, some regional and other state and local. But we're always looking for opportunities like this to get out in front of people and share and help educate. I think that's a big piece of the accounts payable space and automating any process. It's education. So anytime we can get in front of people and help them feel empowered to automate and move their business forward, that's what we're looking for.
Great. So I have two more questions for you. There's a lot of businesses that will talk a good game about being more than just a transactional relationship, right, with a provider. They talk a good game about being an innovation partner. We're going to come in here, we're going to look at the problems together, we're going to work shoulder to shoulder, we're going to get after this, we're going to improve us and you together. But, when it really comes down to it, maybe they kind of disappear after the contract gets signed. Though everybody's talking the game. It's clear that Paymerang is delivering on that promise. Right. What I want to ask is, do you have guidance for health system leaders to help them spot the difference between kind of that platitude sort of version and the genuine version of vendors that are out here really trying to form strong partnerships? Can you give them any guidance on how to separate the two?
Yeah, and I mean, there's certain metrics out there. Net promoter scores are a big one. That's something that we pride ourselves on, and we survey our clients, and they give us a score on if they would, promote us to other peers, organizations. That's one metric that healthcare leaders could use to see where companies fall in that. I think also just opening up the conversation to ask people, hey, what are you doing once I sign the contract? What happens after that?
Sure.
We have a very clear plan on, we have set check-ins, 30, 90 annual reviews. So we know that our clients are going to be expecting those meetings. Yeah. They can expect that. They know that. But in the meantime, they know it's an ongoing thing. They know there's an open line of communication. They have a designated client account manager that they can call. Yeah. Those are just some pointers for leaders.
Right on. So I mean, I have seen some times where the purchasers kind of have this, well, show me how we're going to do it. Get this done for me. I want to innovate. Like, how does it happen? But really, it's the ones who lean in that succeed in creating the value in the partnership that can exist between a provider and a vendor. Well, the last question I want to hear from you is, when you see that success happening, I'm sure that some part of it is that the provider is leaning in a meaningful way. They're doing specific things. They have to play a role, right? It's a two-part equation. Do you have suggestions for providers who are engaging vendors, right? They did the steps that you were just talking about. I've identified the ones that are being genuine about creating partnership, innovating together. Now I'm engaged. What would you suggest? What have you seen work for getting the most now out of that partnership? So I'm lined up with a vendor, and they said they've got these open communication lines, they've got other processes. How do I, if I'm a provider, succeed in getting the most out of that relationship?
Yeah, I think it starts with you as a leader.
Sure.
I think being excited and having the buy-in of you is going to trickle down to your team. You know, if they feel empowered and they see that you're excited about a new solution or a new vendor, then that's going to transfer to them. And, you know, I've been on the other side where I've spoken to some of our clients to get feedback, and I think also empowering your team, being able to you're providing them a solution and innovation to help make their lives easier.
Right.
And so at the end of the day, it's a win-win for you as a leader and for you helping to train them to use it.
Okay, so like I said, it was my last question. Maybe it's a question, so forgive me if this is what's happening. I want to just hear from you, because I know you guys are definitely rocking on the innovation side. You're succeeding in that way. I've driven this conversation with my questions, but you may have things that you didn't have the opportunity to say because I didn't ask the right question. If there was a question that I should have asked you to get your thoughts on innovation and empowering providers and that type of thing, what did I miss? What question should I have asked?
That is a good question. Let me think. I don't know.
Did I cover it?
I think you might have
Gold star.
covered it.
I'll give myself a gold star.
Yeah, I wasn't prepared to ask you a question.
No, that's all right. Okay, well then what I want to make sure is before we leave, I do want to make sure that the audience understands, first of all, how they would reach you, because you're sharing some valuable thoughts. I want them to be able to continue to get great thoughts from you. And then where would they find some of the resources that you guys are putting out there to guide providers in succeeding in this space? Where can we go?
Right. Well, I think the first question to start is, I'm sure people are probably wondering, can Paymerang help? Do I need Paymerang?
Sure.
What does Paymerang do?
Yeah.
So I will say, if you have a finance team,
okay,
if you are paying bills by check, we can help.
Dig that. Easy first sign. Done.
Yep.
Okay.
So if you've answered yes to that question, you're writing checks, Paymerang can help.
Where should they go?
They should go to paymerang.com.
Okay.
We have a resource tab specifically for hospitals.
Perfect.
So leaders can go there. There's some great resources. There's blog posts. There's case studies. More importantly, they can just reach out to us through our website and set up a meeting to learn more.
And they can find you on LinkedIn?
Yes, they can find me on LinkedIn.
Okay, your full name?
Colleen Crist.
Great.
Yep.
Colleen, thank you for taking time with me today. I really appreciate it.
Thank you.
Great conversation.
Great.
Thank you.